Welcome to this short clip where I discuss the major findings of our article, "The risk of developing cardiovascular disease is increased for prostate cancer patients who are pharmaceutically treated for depression." My name is Dunja Schormans and I am an expert on the role of psychological distress within the field of cardio-oncology. Common late effects within prostate cancer survivors are cardiovascular disease, but also psychological distress like depression or anxiety, for example. Cardiovascular disease are common within this patient population because they have received cardiotoxic cancer treatment like chemotherapy, radiation or hormone treatment. However, there is variation. Not all individuals who were treated with cardiotoxic cancer treatment develop cardiovascular disease. So other factors play a role. It could be depression and anxiety, because we know from non-oncological populations that depression and anxiety increase the risk of developing cardiovascular disease to the same extent as smoking, for example. From the field of psycho-oncology, we know that up to 1 in 4 individuals develop psychological distress, such as feelings of depression and anxiety. So this led us to the following research question. Is there an association between anxiety and depression and incident CVD among prostate cancer survivors? We developed a study including prostate cancer survivors based on the Netherlands Cancer Registry and linked this to drug dispense information from the Pharma database network. And we used this information to indicate whether individuals were depressed, were anxious or had cardiovascular disease. Our results showed the following. For our over 5,000 prostate cancer survivors, nearly 6% of them developed cardiovascular disease. And when we performed our Cox regression analysis, we saw that in those individuals who were treated for depression, the green line, had a 51% increased risk of developing cardiovascular disease compared to those prostate cancer who didn't receive pharmaceutical treatment for a depression. This was independent of all kind of traditional cardiovascular risk factors, of course, and independent of cardiotoxic cancer treatment. If you want to know more about our study, the additional findings, please read our article in the British Journal of Urology International or send me an email. For now, I want you to keep in mind, the depressed prostate cancer survivors may have an increased risk of developing cardiovascular disease due to these impaired feelings of depression. Thank you for watching.